Okay, it's my turn now. So, first of all, I'd like to introduce me briefly. My name is Ching-En Chen from Taiwan, Taipei Veterans Hospital. And it is my hospital. It is one of the biggest hospitals in Taiwan, but it's not famous in plastic department. When we think about the plastic surgeon from Taiwan, you always think about Ching-En. So I'm not from Ching-En, but I finished my medical degree since 2011 and go military service for 1 year and start my PGY, resident and chief residency at my hospital. And since 2019, I become an attending. And I went to Ching-En for 1 year, 2022 to 23. I was there in craniofacial team. And then I start go aboard for my fellowship since the last year, August, until now. People always ask me that why I come to Asan. This is what I did in my hospital. It is my daily practice. I did team A's work, team B, and team C. And this is what I did. I always think I always be like this, when I was a resident. And when I collecting the old photos, that I thought that Professor O ever told me that when he was a resident, he hadn't been home for several days. There's a chance. And when he got a chance, and when he can drive home, and he fall asleep on his car. And when he wake up, he's still in the driver's seat. So he drove the car back to the hospital and then continue work. So I think I need to change. Although it is right now in Chinese, I'll translate into English, okay? I cannot read any Korean. It is like to stay true to your original aspiration. Don't let how far you have gone make you forget why you start. That's true. So I try to find what's the deep in my heart. Why I want to be a plastic surgeon. Yeah. That's why I'm here. So I plan for the visiting, the fellowship, and thank for Professor Choi that I have the chance to be here. So that's why I'm standing here 6 months later. Okay, it's a little bit serious. Okay, I give my farewell talk a topic today. It's like the topic is professional growth through a 6 months craniofacial fellowship at Asan Medical Center. Okay, first of all, why Asan? I think that's because Asan is one of the best hospitals in Korea, even in the world. So I choose Asan. I want to see more and be more, upgrade. This is the surgical volume within these 6 months in craniofacial team. To be honest, I cannot join every caloplasty or ABG's case, but I'm really enjoying the surgery of microsurgeries, rhinoplasties, blah, blah, blah. And I thought that I printed red because there are no cases in my hospital. Even we are the biggest hospital in Taiwan, but we have no cases. The blue one is the common case. But the yellow one is the rare cases in our hospital. So I just color it. So I know that I can learn something. When we look into details, I'm more focused on microsurgeries, and we did most LT flap, but it is really interesting that we have some 6 scapular case, thank Professor King, and 3 thin dia flap, thank Professor Choi, and we have much fibular flap and forearm flap, even forearm flap for the columella recon. And I read it in the book, but I never seen it. So for head and microsurgery, this is what I used before here. There are a lot of head and neck cancers, nomen tongue, mouth floor, hard palate, maxillary. Oh, I know this before here. I know only ALT, forearm, and fibula. That's what I did. And now I know how to shorten the harvest time. And I know I can do it better. Functional, sensate, and I have better flap choice, like Tdap, scapula, medial sural flap. And now I know how to use it like thickness control. I can do thin dia ALT. When I'm doing the fail talk, I think like a slideshow, like I put a lot of pictures on it. Head and microsurgery, now we did lots of thin LT, thin dia flap, and Tdap flap, and scapular flap. You can see the picture, that is not so big. We have a really good pre-op design and the cutting guide. We put the scapula within 3 pieces, and even 3, this called chimeric. We have bone, we have skin, we have the muscle. You see, even it is about midnight, 12. Everyone is smile on his face, right? Even it is midnight. Same for Asan. I never seen cranial stenosis case in my hospital. And I know that only for 1 block advancement, blah, 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 techniques. I even bought my book here. I read it again. That I already passed the test 5 years ago, but I never seen a case in my career. So I bought a book, I read it again. So I know, even I still cannot meet any case in my hospital, but now I know what is going on, what is going. And facial bone surgery. I have no OP photos here. I search about all the photos because I always on the table. I want to learn something, so I have no photos. I got only 3 photos here. Okay, we did level 1 BSLSO, molar mandible reduction, genoplasty, and we applied the 3D image. And we did 2 cases about feminization surgery. We did frontal sinus setback, orbital ring contouring, even some brow lift. And 1 case, we combined with 2 dual surgeries, and genoplasties, thyroid culture shape, and neck lift. I think in Korea, the facial bone surgery is really, like popular or common case, but in Taiwan, it is not so many. We have no such many cases. So I learned a lot. I know the detail. Yeah. And rhinoplasty, septoplasty. We have how we recount the framework, harvest rib cartilage. Thanks for Ho-Yon. And we did 5 dice cartilage, several flap, hinge flap, forehead flap, and forearm flap for columella recon, composite graft, and the local high flow oxygen treatment. And we are now doing the preservation rhinoplasty. I heard the name, but I never seen the surgery. Thanks for Professor Choi. And facial reaniimation surgery, I did it before I come here, but only 2 cases. And one of case I failed. I cannot find the masseter nerve. It's really deep. And I'm really afraid of injuring the facial nerve, the frontal branch. But here, thanks Professor O, I see everything really clear. So I know how to use the facelift incision, masseter nerve identification, tensor fascial lateral sling, and do the free gracilis transfer. Okay, you guys should remember this picture, the tensor fascial lateral sling. I will let you know later. And I have some caloplasty, palatoplasty, and ABG case. But Professor O is not here, but I have to say sorry because after observing some surgery, I think I have no talent to do caloplasty, you know. I even draw some the design, the flap design on my palm. I think about 2 or 3 days, but it's really like art. It's not surgeries. I can't realize everything, only maybe 70%. But that's good. I never seen case before. And same for Professor Om and Professor King. I enjoyed some breast surgeries. Free DF flap, although I did some DF flap before, but now I know how to do better flap inset and use the intercostal space. And free lumbar artery perforated flap. I know I should use arterial graft to elongate the pedicle, and some implant-based reconstruction. I know how to identify the plans and the utility of ADM. And thanks Team A, Professor Hong, Professor Peter, Professor Park, and Professor Kwan. To be honest, Professor Peter, I love skip flap now. I know it works. Thin LT flap, gracilis muscle transfer for ABI, medial plantar artery perforated flap. I think I mentioned this flap, but thank Professor Kwan. Now I know. And we also did one free joint transfer case. And medial shura flap, and thanks Professor Chan, Professor Park, that we have discussed about the venous flap. And we did a lot of lymphatic surgeries. We have LVA, end-to-end, side-to-end, LNVT, although we have one case of a momentum flap. And the lymph node to vein osmosis, LNVA, even it is from inguinal, or now that is really popular topic that we use for Alzheimer's disease. And debulking surgery, liposuction, use of the BioBridge, and thank Professor Park. He always emphasized me to do the ultrasound mapping. I'm trying my hard. I tried. Yeah, I'm still learning. Thank you. Here, we have so many education activities. We have outpatient clinic. Although we are surgeons, but we are also doctors. We have to care about the patient. We have to trace the history. We found the problem and the question. We have to solve it, and then we should follow the patient, every patient, because we are not only a surgeon. We are doctors. I love the case conference and the research meeting. Yeah, because we discuss always deeply, and Professor Choi always give us a lot of lectures. I have some papers have to read after that, and every visitor or professors here, they share their experience, even from abroad. So I know where European doing, where US doing, and we have a really good brainstorming. A master class lessons, like Professor Lin from Taiwan, Professor Richard Warren, who is really famous on facelift, Professor Tu from Chang-En is famous on ear recon, and Professor David Son. And thanks for the chance I can visit some private clinic. Thanks Professor Huang and Professor Chen. There are so many congress here. It's really good. I joined the wound meeting 2025, and I know that beyond the deep agreement, we can do much more. APS Korea, thanks Professor Oh and Professor King. I can join the lecture and listen to the masters that really opened my mind. You're here. I have to say, you are so brave. You fight your fight. You fight for your right. You are so fortunate. You have so many idols and models to follow. Yeah. And your future are so bright here. So welcome back here. Asan Medical School, not school. Asan Medical Center has an outstanding history. I found these pictures here. So thank you for letting me be a part of this. Thank you. Thank you. I'm sorry.
Chen,
Yeah.
so first of all, I really appreciate you summarized what we did together, and as well as what we are doing. Actually, you made me and you made us realize what we are doing and what we should do from now on. So we will support you, we will help you, because we became already friends. So I'm really impressed your humble personality, because you are not resident, you are not fellows, you are professors and faculties in one of the biggest hospital in Taipei, in Thailand, in Taiwan. So I really appreciate your strong support and enthusiasm. So it will be remembered for a long time. Thank you.
Thank you.
Ching-En Chair, the Department of Plastic Surgery at Asan Medical Center, University of Busan, acknowledged the completion of your fellowship. He participates as a key member of the team, achieving the clinical and academic goals. We will cherish his friendship and we wish great fortune in his days ahead. Thank you.
Thank you.